How's it going, guys? We have a pass level question for microbiology for step 1. Very similar question. Shows up in one of the nbme exams. Cut to the chase, not waste our fucking time. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like, really appreciate it. Find me on Instagram at mehlman_medical, mehlman_medical. Links down below. Find me on Telegram. Links to the Telegram group and channel are down below. Now start the clip. So 49-year-old man, 1 month history of worsening productive cough, febrile at 101 Fahrenheit. He has history of alcoholism. Sputum is foul smelling. Culture of the sputum shows numerous gram-positive cocci, gram-positive rods, gram-negative rods. There is no growth of the gram-negative rods in aerobic conditions on McConkey agar. Chest x-ray is shown. And the question wants to know which organism represents the gram-negative rods. The chest x-ray, this is clearly a pulmonary abscess, okay? Now, we interestingly don't have an air fluid level here. They don't have to show you an image. They can just say chest x-ray shows air fluid level. That's a buzzy way that they can describe pulmonary abscess. Air fluid level, if they show it, will classically be a circle where it's a semicircle. The bottom half is white. That's your pus that settles due to gravity. The top half being your air, okay? So we know that this is a pulmonary abscess. We have a circular lesion and alcoholic. That's aspiration risk. Now, this is the first very, very important detail here for this question, which is foul-smelling sputum. That's very buzzy for anaerobes on USMLE, okay? It's not limited to this question. I'll talk about this more. But this is anaerobic bacteria we're talking about in the setting of a pulmonary abscess due to aspiration alcoholism. So let's just whip through the answer choices here. We'll go backwards. Gram-negative rods, what's the answer? Choice C, Peptostreptococcus, wrong fucking answer. Clearly, coccus, not a rod. Okay, this is a gram-positive coccus, which is normal oropharyngeal flora. That's represented by the gram-positive cocci in the culture. Nevertheless, wrong fucking answer. Choice D, Mobiluncus, wrong answer. Oropharyngeal normal flora. This is going to be gram-positive rods. Okay, so you can just be aware, Mobiluncus, Peptostreptococcus, they're part of oropharyngeal normal flora. Yes, they'll be present sometimes in pulmonary abscesses, but in this case, gram-negative rods we're talking about. So let's just keep moving through. E. coli, choice C, wrong fucking answer. Now, we have here no growth on McConkey agar. E. coli grows pink on McConkey agar and metallic green sheen it has on EMB, eosin methylene blue agar. Now, that sounds very nitpicky and low yield. I just said this question's pass level, but the pass level detail is the foul-smelling sputum reflecting anaerobes. Now, Bacteroides is oropharyngeal normal flora. It's actually throughout the GI tract, and it's a strict anaerobe. And you need to know this causes foul-smelling purulence. So, as I just fucking said when I was talking previously in this question, is it's not limited to pulmonary abscesses. They have questions on the nbme where they say patient had abdominal surgery and there's a fistula draining foul-smelling purulence, and the answer is Bacteroides. And they'll say there's no growth on aerobic conditions on McConkey agar. Well, clearly Bacteroides is anaerobic. It's not going to grow in aerobic conditions, right? So I would say 90% of the importance of this question is knowing Bacteroides is anaerobic and it's foul smelling, okay? And it's part of oropharyngeal normal flora that can be aspirated, pulmonary abscess here, okay, as well as abdominal surgeries, as I mentioned. And E. coli, it's not strictly anaerobic. The 10% could be knowing that it's pink on McConkey agar or metallic green on EMB agar. Corynebacterium is wrong because although that's normal flora of the GI tract as well, this is gram-positive rods, okay? So you also need, and I'll end on this, you need to know pulmonary abscesses are treated with clindamycin, which is anaerobe, clindamycin treats anaerobes above the diaphragm, metronidazole anaerobes below the diaphragm. You know the deal. To make more content, if you like my stuff, subscribe to my channel, and I appreciate your time. That's it.